Hello, everybody. We welcome you to A2I Dyslexia Live Show. All the way across London somewhere, we have Sunil. Sunil, remind me, how do you pronounce your surname?
It's Chothi.
And Sunil, can you hear me?
Yeah.
How do you pronounce it?
Chothi.
How do you pronounce your Chothi?
Chothi.
Right.
Yeah.
Chothi. Wonderful. Yeah. Now, let me just remind our viewers that I am dyslexic. I've got dyslexia, dyspraxia, dyscalculia, and I have Erling syndrome. And one part of my dyslexia is pronunciation. So if I'm asking a lot of our guests, how do you pronounce, it just means that I can't pronounce it. Pronunciation is a huge problem for me. So I just thought I'd share that with our viewers before we actually move on. So Sunil, we have Sunil on the show today. And this particular topic we're about to speak today is very, very close to my heart, because I had to fight for my son through my local authority about maybe 15 years ago for him to have what they used to call a statement at the time. Is that right, Sunil? It used to be known as statement, isn't it? It's now educational healthcare plan. And my son has an ADHD, and I had to literally keep battling until in the end he was given the support he needs. So it's very, very close to my heart that what we're going to speak about today. Now, Sunil has worked in special educational needs for over 16 years, but I'm going to get him to introduce himself in a minute whilst I introduce myself, who I am, because we get new people join the show every week. So my name is Elizabeth Techi. I'm the founder of A2I Dyslexia, and we support dyslexics in our community and beyond. One of the areas where we have a lot of phone calls and parents are tearing their hair out is educational healthcare plan. It can be very complex. And I think we're very, very, what's the word I'm looking for? Lucky to have Sunil come on the show today to give us the ins and out of how to, apply for EHCP. I think I've got that right, or Educational Healthcare Plan, and also parents, the rights for parents and the procedure. He is an expert. He's worked with some amazing organization over the 16 years he's been working. One of them, great organization in Battersea, Centaur, who works with parents who have got children with ADHD, and also A Second Voice, an amazing organization, again based in Wandsworth, and she works with autism and other specific learning as well. And Sunil have given talks in the past, and you couldn't get anyone better to give you the information you need today. Sunil is the right person. So Sunil, I'm going to hand it over to you. Introduce yourself, tell us a little bit about what you do, and we just dive straight into the show. And it's really a pleasure having you here today. So over to you now.
Thank you. Yeah, thank you for the invitation, Elizabeth. Hope you can hear me clearly.
Yes, I can hear you. I'm sure everybody can. Yeah.
Wonderful. Okay, so basically, as you said, I've been in special needs for about 16 years, and I've had a varied career. And actually, going back even before the 16 years, I was actually a teacher. But when I got into special needs, I was actually employed by local authorities. I worked in SEN teams right across London. And I actually started off as a case manager. Then I went up to management, and then actually I got to quite a high level in working for the local authority. I was actually even head of Sen at one point. And what it's given me is quite a lot of insight into how local authorities operate and a lot of the barriers the parents face with obtaining and securing the right support for their child. So what I done in about 3 or 4 years ago, it was always in my heart to really support parents, and I have a great passion to really use the expertise which I've gained to support families. And one of my greatest passions is really about helping as many SEN families to support and secure the right support for their child in school. And so I've been doing that for a few years now, and I help parents with any kind of dispute with EHC plans when they're refused, local authorities refuse to assess, or parents are looking for a specialist school, or any kind of dispute regarding EHC plans and local authority. I support parents with tribunal representation, which is a big part of my job, and really just navigating parents through this SEN maze. It can be a very complicated, very bureaucratic, very frustrating, very emotionally draining process. But my passion really is to support as many SEND families as possible and ensuring that they get the right support. I do have a cliche, which I often say in my talks, and it's knowledge is power. And I think that definitely when a family and the parent knows about their legal rights and what they're entitled to, it can make a huge difference to the outcomes for their special needs child. So I support organisation I run is SCN SAS, and support parents right across London and beyond. So we are very much a national organisation supporting parents right across the country with all kinds of EHC plan disputes and support with tribunals right across the country. So that's kind of myself in a nutshell.
Wonderful. Excellent. Thank you so much for that introduction. Because when we sent out our emails to many people that we serve, this title was like, oh, it's a bit of a handful. So I had to get used to it. It was like, securing educational support for your dyslexic child through an educational healthcare plan. And I thought, how'd you shorten that? I thought, well, you actually can't shorten that. Let's just go with it as it is. And I think it's great the job you're doing, because I want to share a little bit about my journey. My son's got ADHD. He's now grown up, he's finished his university. And I remember the time when he was younger and I had to go through with my local authority, I had to get support for him. I can't begin to tell you the struggle I went through. I didn't understand any of it. I think at first they even refused him, and then I had to appeal for but I had to go and use a solicitor. I had to go to solicitors to get their sort of help. It went on backwards and forward for a good 3-4 years before he got the support he needed. I think he must have been about the age 9. He didn't even get his support. He was like 13, 14. So that's how stressful it can be. And I wish I could have found someone like you at that time who would have literally guided me through. And I know there's loads of parents that don't even get to this stage. So I think today's show is going to be really phenomenal for many people. But before I start, someone actually gave you an amazing feedback for work that you did for them. And I just want to read that out to our viewers before we carry on. Now, I cannot thank Sunil enough for the time, support, and advice he gave us throughout our son's EHCP appeal process, all the way through to the tribunal hearing. Throughout the process, Sunil consistently kept us informed with any updates on our cases and reassured us with his knowledge and experience. I am so pleased with the outcome of the hearing and cannot thank Sunil enough for the help he gave us and supported our son. I would recommend Sunil to families who need help and guidance in getting the support they need for their child. And it's not just the only feedback. There's loads of feedback. When people got our emails, some people were like really jumping with joy. I think you've helped a couple of people that we also know through educational healthcare plan. Now, let me move on to my first question. What is educational healthcare plan and how can parents access this?
Right. Try to make it in a simple definition. Educational healthcare plan is a legal document, and it's quite important to remember that it protects your child's education, and what it effectively does, it describes the needs of your child and the support they need and the outcomes which is required for them to achieve those outcomes. So what it basically is, it recognizes the child's special educational needs, whether that's dyslexia, whether that's autism, whether that's ADHD, or a combination of needs. It's a clear definition, description of needs, and then it describes the provision to legally required to meet that child's needs. So it covers educational elements is the strongest part, but it also includes health provision, social care needs, hence the name educational healthcare plan. And as you alluded to earlier, it was in 2014 it actually replaced special statements, which some people may remember from a few years ago.
Right. Okay, because I know when I got my report, it was as thick as a Bible. I thought, God, what'd you do with this? It was so, there was so much in there. And I'm glad that I took that step forward to go. And I know a lot of parents struggle to really go for that support they need. So I'm just fixing my hair at the same time, really struggle to go for the help that they really need. And I think you being there to say, look, come to me, I will hold your hand through this process. It's just phenomenal. And you couldn't ask for anything better than that. You're actually based in Wandsworth, are you?
I'm actually based in Wandsworth, yes, South London. As I said, we cover right across London. I have families in Birmingham, Milton Keynes and beyond. So I get families contacting me all over the country, to be honest.
Right, yeah.
With the same kind of issues.
You are doing amazing work, honestly. Really, really. I mean, when we contacted you and you were able to come on the show, I was really, really pleased, because I can just imagine in September, children going back to school. We've been not going to school. Our kids haven't been going to school for what? It will be 6 months, wouldn't it? By September. Oh, yeah. And it's like any parent that's got a dyslexic child or any child with specific learning difficulties will probably really need or may see that actually I didn't realize that my child might be struggling, but now they are. What can I do? So I think it's really great that this is really well timed for what we need it for. So why is it important to have EHCP? Have I said that right?
Yeah, well, actually, for reasons. I think that one of the reasons is that I'll start off this way. The children of SEN who don't get an EHC plan, very often their SEN provision is woolly, it's vague, and there's little accountability, and it's not always very clear to parents what is actually in place to support their child. Also, it's not legally enforceable. So schools would often maybe try to provide something from their own resources, which is not always, it might always not be the right support. They might not have the resources for the right support. So I think that it provides clear support, it's transparent, it's legally enforceable. That means that once you've got an EHC plan, there's by law, schools and ultimately local authorities must ensure that it's delivered. It's transparency, and it also brings about accountability regarding the regarding those who are delivering the education of your child. I mean, with an annual with an EHC plan, it's reviewed annually every year. So you have all the professionals around the table, and you're looking at your child's reviewing your child's needs. Is the provision working? Is it enough? Does there need to be changes? And it brings about an accountability to those working with your child. So I think also, especially with children who do have a diagnosis of dyslexia, they can get get left behind a little bit. And to be honest with you, it'll be very hard if a child requires specialist dyslexia support, say for example from a teacher. It can be very difficult to secure it without an EHC plan, because this is expensive support. But with this support, the EHC plan, you can actually have a great package of support for your child in school.
Right. So why do you think it's so complex to go through this? Why is it so complicating, and why is it so draining for one to go for educational healthcare plan, when as a parent you know that that's the best way that your child will be able to focus at school and learn? Why is it such a complex sort of procedure? Well,
it's a procedure. I mean, it's a very as you rightly said, it's a bureaucratic, it's a very bureaucratic procedure, and it's filled. I mean, when we look at the experience of parents, I mean, they often experience a lack of communication, a lack of understanding, a lack of empathy sometimes for the child's needs. One of the things often parents are told is that perhaps your child's needs are not significant enough to get to obtain an EHC plan. And this is very disheartening to parents. And unless you know about your rights and actually what an EHC plan can cover and what is the legal test, which I'll be talking about a bit later, it can be very difficult to overcome. And that's why I say knowledge is power. And when you understand the information and the actual what the law says about protecting children with special educational needs, with learning difficulties, with those with specific learning difficulties like dyslexia, it really does it does really change things. And it's unfortunate in my experience that it's the parents that tend to assert their rights. Yeah, I mean, it is unfortunate. I mean, local authorities wouldn't like to admit that, but the truth is that those who do push and assert and challenge authorities and local authorities, they do tend to get a much better package of support. I mean, when I was when I was employed by local authorities, I saw it time and time again when parents employed maybe a solicitor or an advocate for their case was treated differently. And they got they secured a far better package of support to the families. And I'd say there's many families who just settle for what they're told.
Absolutely.
Which is very unfortunate, to be honest, when there's actually those who do push and do sort of assert their rights and do challenge and do appeal to the tribunal. They often get a much better. I've seen it time and time over and over again. Parents who refuse an assessment obtain their assessment. Parents who refuse the school, their choice, obtain the school. I've seen it time and time again how the parents who are willing to go through a process like this, it does pay off. And obviously having someone like myself or another representative, it can help. It can help manage this very emotionally draining process. And
I mean, I know what that feels like because I had to go through it. And I remember saying, I normally say to some of our parents that come to us, look, I feel like I'm banging my head against a brick wall. And I would normally say to them, don't give up. Now, I wish I had met an organization like yours because it was very draining. And I know at some point my son was on the verge of being permanently excluded from the school because they didn't understand his behavior. But I was very fortunate to have kept going and to have kept fighting for it. And obviously he was given the support he needed. Now, it's very interesting. Marcia's got a question on here. And Marcia said, it's very difficult to obtain an educational healthcare plan for a child or young person with dyslexia unless it overlaps with another learning difference. Sorry, I think we've lost Sunil at the moment. So he might come back to us. Not too sure what's happened there. So if you've just joined us, we are talking about securing educational support for your dyslexic child through educational healthcare plan. And for some reason, maybe the internet on the other line has gone a little bit maybe haywire. And we've actually lost Sunil, but I'm sure he'll join us in a minute. If you're a parent and you're watching at the moment and you feel like you need help and support for your child, this is the best time to really go for the help you need. And we've got Sunil back again. Hi, I'm not too sure what happened there. This is live show.
Anything can happen, of course.
This is anything can happen at a live show. So we I knew we'd get you back at some point because sometimes the internet plays up a little bit. So I was just sharing with our viewers if they've just joined us now and they need that support. I mean, we've got parents that come to us for dyslexia assessment, and then it's like after that, it's like, what next? And this is when maybe you come in and help them to plan for their educational healthcare plan and so forth. So on that question that Marcia asked, if I just had a child with just dyslexia and not the overlapping conditions like ADHD or autism or Asperger's or Tourette's or dyspraxia, whatever it might be, and it was just dyslexia, how easy is it for me to go for educational healthcare plan?
Well, I mean, every case is very individual because to some extent almost dyslexia, can be almost be perceived as a bit of a spectrum where we've got maybe the mild, the moderate, the severe. And the key question isn't necessarily where you are on that scale. It's, are the needs being met? Is the child making progress? Is the interventions in place supporting that child? And that could depend purely on the context of the school. If the school, most schools I've spoken to and head teachers, they're talking about struggling with budget cuts to their SEN support. So in theory, they're supposed to get a £6,000 notional funding that should be used to support children without EHC plans. But many of the head teachers I speak to, they say that this £6,000 doesn't actually exist, and they don't have the funding to support some of the most basic needs of special needs, basic special needs. So it really depends on the context of what kind of the school, borough. It's almost like a postcode lottery, to be honest. The ultimate key question is that is your child's needs being met? Are they making progress? Because if they're not, then these are signals that actually perhaps you do actually need an educational healthcare plan to secure a higher level of support. Because if that support cannot be secured through SEN support or the notional package of support offered to schools, then it has to be secured by another route.
Absolutely. I agree. Yeah, entirely. Yeah, I agree entirely. Now, like I said, with my son and going through the statement procedure, one thing I don't regret is that I saw it through to the end. I was not going to give up, because it was either that or he'll end up either permanently excluded or he wouldn't have got the education he needed. Now, I can proudly say he's a graduate. He's graduated with a 2-1 and he's doing very well. He's running his own business and doing things really, really well. If I hadn't got the educational healthcare plan, I don't know where he would have been. And I think this message really, I'm sending it out to parents and carers and say, look, you no longer have to struggle, because Sunil is there who can support you through the journey. In terms of how much you charge and all the costs, I think, when individual people contact you, you'll be able to tell them how much it costs for your service. But right now, I think we're more interested in, look, get the help you need if you can. So, let me move on to the next one. What are the criteria for educational assessment to do with the EHCP?
Now, this is actually a key part of my presentation. This is because the criteria, when we talk about the legal test for an EHC assessment, it's actually a very simple test. And the test is, if a child has SEN, like dyslexia, or might have this, or may have SEN, the local authority must, note that word, must assess. So that is the simple test, that if a child has a diagnosis, if a child has some evidence of SEN or some kind of underlying conditional struggle, on that basis, the local authority must assess. So that is the legal test we go to tribunal with. That's what we appeal with. But unfortunately, what many parents encounter is that when they request an EHC assessment, they are given lots of reasons why they can't carry out the assessment. I'll just give you an example. For example, the local authorities say it doesn't meet our criteria, but the local authorities have their own internal criteria, but it very often doesn't line up with the piece of law I just quoted. They say things like, well, a child's making good academic progress, or we need three terms worth of assessment, assess, plan, do, review. We need to, your child's being educated at home, or the school. We think the school has the resources to meet your child's needs, or your child hasn't been seen by an educational psychologist. All these reasons are unlawful. Right. But these are the most common reasons that parents are given. They get a letter back and they say, sorry, quoting very often all of these reasons. And when parents come to me at that stage, they say, what can we do? Typically, I would appeal to the tribunal on their behalf. And all those reasons, because those reasons are unlawful, they cannot stand up in tribunal, because the legal test simply is the local authority must assess if a child has SEN or may have SEN. Right. So the law is far more stronger and always trumps local authority policy and their own criteria.
Right. I know in the past where parents have said, you know what, I can't be doing this, and they give up halfway. It's so complicated. I have been through it, so I know how complicated it can be. And it can be very, very stressful. Yeah. So having someone like yourself, who is the point of contact, who knows the jargon, who knows how to kind of, the step-by-step of giving that parent that support, it's just amazing. And I believe and hope that after this show, every parent or carer who's got a child with just dyslexia, this show is about dyslexia, but if your child's got dyslexia or autism or ASD or any other specific learning difficulties, and it's not just dyslexia, please do contact Sunil, because even though the show states that it's for children with dyslexia, but your child might have overlapping condition, and please do contact him if that's the case. Yeah. Right. So thank you for that answer. So if anybody's joined us just now, I just wanted to share this with you all. Today's show is about securing educational support for your dyslexic child through an educational healthcare plan. If you've just joined us and you're a parent or a carer, or a friend who's got a child with specific learning difficulties, we really want to welcome you to the show. Do share the program. Do drop us your comments. This is an opportunity to really just, tell us what help you need. And we do these shows. I mean, someone contacted me and said, why do you do these live shows? And I said, because look, we do it as a way of give back to community, because there is so much information out there. And particularly for a lot of dyslexic parents, for example, not everybody's going to go and read about all these things. But if we put on a live show like this, you can engage. It's visual. You can watch, you can hear, you can share it with a friend, you can share it with a family member who really needs that support. And our key, the aim of why we do this is so that children are not struggling. My dyslexia was picked up at a very sort of old age. I mean, my mid-30s at uni. Can you imagine the struggles I would have gone through before getting the diagnosis I needed? But can you imagine also if I was assessed at the age of 7 or 8? What difference would it have made? And I'm talking about mental health. I'm talking about anxiety, depression, panic, worry, stress, all sorts of things that go with specific learning difficulties like dyslexia. Sunil, thank you so much for answering that question. And you answered that so well, honestly, really, really well. Now, the next question I've got is, if application is refused, what will be the next step for a parent, and what are the parents' rights?
Well, once the local authority has issued the decision letter, parents have up to 2 months. So within 2 months, they can appeal to the SEN tribunal. Once they've appealed to the tribunal, it forces the local authority to reconsider their decision, and they have to make a decision whether to defend the appeal or simply concede. So it's really, after you've got your decision letter, you'll be informed about your rights. And it's kind of at that stage, parents contact me and I kind of step in to kind of actually do that for them. But there is a specific time frame in which they have to actually appeal to the special needs tribunal.
Right. Okay. So what are some of the reasons why they refuse, parents? I know you've touched upon some of them, but what are the typical ones that you see every day in your work? Yeah. Mm-hmm.
Well, one of them is they might say, well, if your child's moving schools, they will say, well, we want to see how your child, though we recognise your child's got SEN, the child's struggling, but we want to see how they get on when they move schools. So that's right, okay. That's one reason I get. Another reason is simply, they recognise that your child has SEN, has some kind of diagnosis, but they think that, well, we think the school can actually meet the child's needs without an EHC plan. That's very common. You even get ones which say, well, your child's making good academic progress. Why do therefore doesn't need an EHC plan? So these like with all these reasons I'm given, they just wouldn't stand up in the tribunal. And later on, you'll find out exactly what you'll be very surprised when I tell you about the success rate. But all these reasons are barriers which parents face, and it's very disheartening because if you don't know where to turn, parents will just simply settle for less.
Yes, absolutely. Yeah. It's difficult being a parent in general. And then you've got that added on top to go keep fighting. So in some, especially if a school's telling you that academically they're going to do really well, I think sometimes you think, okay, well, maybe I'll just agree,
Yes. And actually, and also another common reason is parents say to schools, they ask the advice of the SENCO, what do you think? And lots of times SENCOs will say, your child does not need an EHC plan.
Wow.
And that's another barrier. But I've seen many cases where that's been overturned because it's not the SENCO that has that's not the test. Whether the school it's the legal test, which I quoted earlier. That's what decides about the EHC assessment and the EHC plan. That's the test.
Right. And I guess the only reason why local authorities and schools try to move away from this is all to do with cost, I guess.
Well, I think, yes, I think definitely there's definitely a cost implication, because with every EHC plan, there's additional resources, and we know that local authorities are under budget, so they're sort of desperately trying to make savings and cuts and try to manage their budget. So where they can refuse EHC assessments, they will.
But
And
I mean,
Elizabeth,
however,
I will tell you something. Yeah,
I was going to say,
actually,
however, go on.
Yeah,
you
go on.
No, you go,
Actually,
Sunil.
I was saying, it's a live show, isn't it? We haven't rehearsed this, have we? I can actually tell you from the other side, because I've been employed and understand how local authorities work. Some local authorities think that, well, even though we've refused to do an EHC assessment, sometimes some of them think that, well, if the parent appealed, we know that we will not succeed, therefore we'll then carry out the assessment.
Oh, right. I see. Okay.
So, yeah.
Right. Well, that's something we will never have known. So thank you for sharing that with us. And obviously, I mean, one of my passion is that every child who's diagnosed with specific learning difficulties, dyslexia, autism, ADHD, whatever condition it might be, I hope that they can get the help they need. Because I know for my son getting the help, he's just become a total different person. I also know that with me getting the support I need as a dyslexic person, I'm complete, I learn differently. I've achieved quite a lot. I think I like to say that. I'm very proud. And it's all through the help I got. So can you imagine if there is no support or no help out there, or there is, but you can't tap into it? And that must be really frustrating for some people. But like I said, it's great having you on the show to tell us the tips and if and buts and what we should do to really move on forward. Yeah. Right. Moves me to my next question. How long does it take to appeal the decision of the refusal? And what are the success rate that you've worked with? Maybe it's two questions in one. So maybe one at a time.
Yes.
How long does it take for the appeals decision? Yeah.
Yes. I mean, the appeal process, it can be quite a long process, to be honest, but it's once a parent appeals to the tribunal, it can actually be, the whole process could be around a 20-week process. So you'll have the option of a paper, what we call a paper hearing or an oral hearing. And actually, since the COVID-19 impact, all tribunal hearings currently are done through a video link. So which is generally running. I mean, I've done several of them, and they're running quite effectively, actually. So, but generally, when they appeal, it's around a 20-week time scale. You'll be given an opportunity to submit evidence as well as local authority, and if it's necessary, you can have an actual hearing where you'll be able to discuss and present your evidence before a judge or an advocate to support on your behalf before a judge and a specialist panel. Before COVID-19, it was actually done in a court, which can be a Royal Court of Justice, which can be quite intimidating. But it's actually far more relaxed to actually be doing it like this through video hearing. So most parents I'm working with actually prefer it now. So that's the answer to the first part of the question. Now, success rate. Now, the general tribunal success rate for parents, this is the national rate, this is for all types of appeal, is 89%, so nearly 90%. So it's very high.
Is that your success rate, or as in general appealing for educational healthcare plan? Or is it your success rate?
That's the success rate, national success rate for everyone.
Excellent. That's amazing.
That's the national success rate for. So it's nearly 90%. Now, listen, we're talking about refusing to assess, but the refusal to assess is closer to over parents winning it for around 97%. It's huge. It's actually huge. And the reason why is once a parent appeals against the local authority's decision to refusal to assess, the majority of local authorities concede and just simply do carry out the assessment. The reason is that the law, the bit of law I just quoted earlier, is a very high legal test. If a child has SEN or might have SEN, they must carry out the assessment. So because of that high legal test, the majority of local authorities realize they can't defend the appeal, and therefore they'll just simply concede and they carry out the assessment. So parents who appeal against a refusal to carry out an assessment, very, very high win rates for them, but they probably would not even need to go all the way to the tribunal. and local authorities generally concede and don't defend.
Oh wow! Just can you imagine if you've got one or two, not just one child, but maybe two children with specific learning difficulties or any condition, and you'd have to do this twice. I can understand where a parent would say, actually, I don't know if I can do this any longer.
Yes.
I don't know why they make it so complicated, but I'm looking at it as if it was, I'm not saying it should be very simple, but if it was something that was straightforward, surely isn't it helping the child to achieve much better within the education system, which means that they can learn better and become better people in society? Why do we have to battle all the time? Is that because, again, it comes down to money? Is it because it comes down to cost and everything?
Yeah, I mean, I do think that is probably a huge aspect of it. I mean, because I've been special needs for a long time now, and actually, I said obviously 16 years. I mean, 16 years ago, a lot of parents didn't. The tribunal appeal. I mean, currently we've got about over 7,000 appeals nationally. It's huge. Wow. It's just increased. But back in 16 years ago, when I first started off in special needs, it was very low, and actually, the local authorities were generally far more agreeable to the request for parent support. I mean, lots of local authorities didn't like going to tribunal, so as soon as they appealed, they would just normally agree, like specialist schools or anything like that. So it's far more less. There's far less of a battle for parents. But as budgets have got tighter, because what simply happened is nationally the rate of special needs has gone up, but the budget to meet those needs has not. It's actually shrunk. So there's been a mismatch, and hence that's why we have so much, issues regarding parents having to really push and fight, against this system. The EHC plan system is supposed to be a parent-centered, child-centered process, but very unfortunately, parents' experience is very is completely the opposite.
Yeah, I mean, we get emails, phone calls, and parents say, I don't know what to do. Where do I go? What do I do? Where do I go for help? And then, like you said, those that shout the loudest get the help they need. In some cases, some people don't even know where to begin with education. They don't even understand what it means in the first place. And I think, having you on the show today, you've made that really clear for us to understand it all, which is phenomenal, and it's amazing. I love the work you do, Sunil. I mean, from the time we met last year sometime, and when you spoke about the work you do, I thought, this is just so great. It's so amazing, because, the help and the support is there, and we can signpost people to come and get the right support for their children. Excellent. So can you give us tips and points in terms of I can't say it. I can't say it. EHCP. I'm doing it the other way around. I'm sort of saying ECHP. It's not that, is it? Educational healthcare plan. Give us some tips and points for parents to. What are some tips you say? I mean, 3 tips that you would give.
Well,
yeah.
I mean, I can. I think that I would say, Jenny, if your child is struggling in school, and even if the school doesn't support you, it's always worth trying to obtain an EHC plan. You as a parent have the right to request one. And if you do that, it's your request, which the local authority will have to consider. And if you do have to go to tribunal, it will be the tribunal that will have to decide the matter. So I say that if your child is struggling in school, especially with dyslexia or any other special need, and they're making slow progress and they're struggling, and you might be getting the message the school is saying, oh, we're doing everything we can, the progress is okay, but if you feel that there's more that can be done, or sometimes parents are even told, the school says to them, we just don't have the resources and to support your child. If that's the case, that's a clear indicator that you need an EHC plan to secure the resources.
Absolutely.
So definitely, it is something worth trying to obtain it. I also, one of my other bigger tips is, for children with dyslexia, try to obtain a dyslexia assessment from a specialist, because that specialist report will be used to support your child in school. And also it can be used where, if, for example, it recommends weekly support from a specialist dyslexia tutor, very expensive, but it can be paid for and secured through an EHC plan. So
right, excellent.
Yeah, so that's one of the tips. The unfortunate thing is lots of local authorities don't have that specialist dyslexia teacher to do the assessment, and unfortunately parents do have to sometimes pay for that to obtain it privately, which is but I can actually say that kind of report, an independent report, local authority, if a school or local authority does not accept it, a tribunal will. It carries a lot of weight. It will have an assessment of your child's learning needs, dyslexia needs, the diagnosis, and it will talk about the provision required to meet your child's dyslexia needs. So it's definitely worth trying to see that it can be obtained for the assessment to support your child.
Excellent. In some cases, it may not just be a specific learning. It may not just be dyslexia. It may be all the condition under the umbrella, which could be autism, ADHD, ADD, dyspraxia, dyscalculia, Tourette's, all that in one. Now, if one's going for educational healthcare plan, I shouldn't assume, but I'm sort of thinking that they will get the support they need as a whole for those specific learning difficulties. Is that right? Or will they look at it individually and then support the child?
Well, I think what you said is true. What it is, the educational healthcare plan will identify all the needs of the child, and the provision will make sure legally there has to be provision to meet all of those needs.
Right. Excellent.
So that's the beauty. It's a holistic document. Yeah. So it will cover all of a child's needs, and the provision will be there to match whatever that looks like, whether it's one-to-one support or dyslexia tutor or some kinds of interventions or specialist equipment or adaptations. It will be within the EHC plan.
Excellent. Now, this is so amazing. Now, if you're a parent and you've joined us, you're probably thinking, please don't go off air yet. But we do only have 4 minutes left. Yeah. And I think it's just so amazing having you on the show. And like I said to people, like when they say, oh, why do you do this show? I normally say information like this. Okay, you could go and read it. But someone like me with dyslexia, I'll go and read it. And I thought, what does all this mean? Some of them are quite the jargon I don't quite get. I didn't understand the difference between education assessment and educational healthcare plan. Now I knew it as a statement. Now it's called differently. It's a different name. So I'm just thinking, if parents are watching, carers are watching, if you're a grandparent and you're watching, if you're a teacher, if you're a Senko, a head teacher, do share this show that we've just aired live. And I think it's very important that children get the help they need, because children becomes adults, and the quicker we nip it in the bud, as the word I use, the better it will be for the parent and for society in general, and especially for the child, because there's nothing like having a certain condition and you don't know why or how to support yourself, but yet parents trying every means that they can to make it all possible. So I think it's amazing and great having you on this show, Sunil. And lastly, how can people tap into your service? How do we tap into your service?
Well, the best way is through my website. It's www.sensadvocacy.co.uk. Also, I have a Facebook page as well, SEN SAS, and people can email me. They can book. I always offer a free consultation, free chat, so to kind of talk about your particular situation. And any of those means you can contact me and we can arrange an appointment. I'm happy to give some advice.
Excellent. And of course, how much you charge through the procedure, you then obviously discuss that with the parent as they contact you, the whole process of the appeal and everything.
I mean, generally, it's a bespoke program because every individual situation is different.
Absolutely.
But generally, as an advocate, I mean, the good news is that advocates are generally far more affordable than solicitors. Let's just put it that way, because when parents engage solicitors, there is kind of you don't always know what you're getting into in terms of the financial commitment. But with an advocate, we generally charge fixed rates, and it's generally far more affordable for many families. And my mission is to try to help as many SEN families as possible. and to make, you know, what I do, because I believe advocacy should be for every family, whatever your socio-economic background. Everyone, you shouldn't be disadvantaged because, you know, of your background. So I'm trying to make what I do as accessible as possible to all families.
Absolutely wonderful, and thank you so much. I can't thank you enough, Sunil, for coming on the show today. It's absolutely amazing having you on the show today. I want to say thank you very much. Our time's up, and we have to bring the show to an end. I wish we could carry on and on and on, but your website is showing at the moment on the screen. We will also share, when we share the video on all our different platforms, social media platforms, we will give your contact details as well and your email. Parents, please don't sit there and worry, you know, alone. There is help out there. Do tap into the services. You can email Sunil, or if you don't know how to kind of contact Sunil, you can contact us and we forward the email on to him. Thank you for joining us today, Sunil. Thank you so much for the knowledge that you've impacted with us. When you first started, you said knowledge is power. I 100% agree with you. Yeah. And thank you so much. And we also want to thank our viewers for joining us this evening. Now, next week, we have the wonderful Marcia. Marcia, I can't pronounce her middle name. Brassett Bailey, I think is her name. And she's Neurodiversity Inspired Champion, co-founder of BDA Cultural Perspective Committee. She's a trustee of Waltham Forest Dyslexia Association. She's also an author, a budding author. She'll be coming on the show, and we will be talking about Generation Dyslexic from a cultural perspective. Now, I'll see you next week, same time, same place. Thank you, Sunil. Thank you very much.
Okay, you're welcome. Thank you.
Okay, wonderful. Bye-bye. Now, see you next week. Bye-bye for now. Bye.
Bye-bye.